Breast cancer wasn't on my horizon. I did my mammogram every year. I did my testing.
It's never in the plan, but it was on the plate. At 50 years old, Sue Paul was diagnosed with breast cancer.
I have no breast cancer in my family. I was the first person that we know of.
In 2011, her courageous spirit got her through surgery and strenuous chemotherapy.
The flock of everybody being behind me and supporting me.
With the intent of helping others, she became active with the Illinois Cancer Care Foundation and Susan G. Komen. As time and research went on, there was a new push for women to get genetic testing to see if they carried a hereditary mutation that increased the risk for cancer.
Of course I said yes, because I'm all about data and helping people, never understanding that I would come up being BRCA2 positive.
BRCA1 and BRCA2 are genes everyone has in their body that work as tumor suppressors. But if the genes are mutated, they actually increase the risk of certain cancers. And the mutation is hereditary. It's a 50-50 chance you'll pass it along.
Also, because I was diagnosed and have the BRCA gene, I have a daughter. And they suggested that she probably go through the testing, and she said, bring it on.
Sue's daughter is positive for the BRCA2 gene mutation. Doctors at Illinois Cancer Care say gene mutations make up 10% of those diagnosed with breast cancer.
That was probably my hardest point, knowing that I passed that gene on to her. But her attitude is so amazing.
And Sue is not alone with this wearing on her heart. Kimberly Tauk at Illinois Cancer Care says psychological health is extremely important in these cases, and they push genetic counseling both before and after someone decides to get tested.
There's a lot of anxiety that comes with knowing this information, but I try to stress to women that finding out that you have a genetic mutation for cancer, like breast cancer, is not 100% guaranteed.
The testing is always encouraged, but Tauk says in some cases it's not for everyone.
Because if knowing that you carry a gene for cancer would disrupt your day-to-day quality of life, then maybe that's not right for you either. So it's really trying to find what is best for that particular woman.
And that's why Sue urges those recommended to get tested, not only for your health, but so your family members know their risks too. Now, Tauk at Illinois Cancer Care says it's important to remember that gene mutations can increase the chance of several kinds of cancers, not just breast cancer, in both men and women. For more details and resources, look for this story on our website at hyabc.com after the broadcast.